Good morning all. My topic is comparison of visual outcome between ringless progressive IOL and diffractive trifocal IOL. There is no financial disclosure. Introduction: multifocal intraocular lens in terms of spectacle independence have played very important role in cataract surgery. Nearly all bifocal IOLs achieved distance and near vision, whereas all trifocal IOL achieved distance, intermediate and near vision, but with photic phenomena and compromised contrast sensitivity. This study aims to analyze visual outcome, contrast sensitivity, photic phenomena, patient satisfaction after bilateral implantation of new autofocus pro ringless polyfocal progressive IOL and traditional trifocal IOL with diffractive rings. This study is a prospective non-randomized comparative study. In this study, sequential bilateral cataract surgery by phacoemulsification technique was performed by single surgeon at Asta Hospital Anand between June 2022 to September 23. The inclusion criteria were age between 45 to 77 years, axial length ranging from 22 to 26 millimeter, and predictable post-operative corneal astigmatism less than 1 diopter, and scotopic pupil diameter ranging from 3 to 6 millimeter. The exclusion criteria mentioned in the slides were taken care of. In this study, we have done a comparison of two IOLs. One is the autofocus pro ringless polyfocal progressive IOL, and the details are of this IOL are mentioned in the slide. And the other is at least a trifocal trifocal IOL. The details are mentioned in the slide. The all the necessary pre-operative measures were done. Post-operative examination include uncorrected distant visual acuity at 3 meter, uncorrected intermediate visual acuity at 80 and 60 centimeter, uncorrected near visual acuity at 40 centimeter, defocus curve at 3 millimeter, and contrast sensitivity with palliroption chart at 1 meter, and a questionnaire regarding spectacle independence, photic phenomena, and patient satisfaction was assessed. The results are divided into two groups. The group 1 include 14 eyes of 7 patients received by bilateral autofocus IOL, and group 2 includes 14 eyes of 7 patients received trifocal IOL. The comparative analysis of pre-operative patient demographics between two groups are not significant. This is the graphical presentation of it. Visual outcome 1 month post-op includes group statistics for mean for uncorrected distant visual acuity at 3 meter for group 1 versus group 2 shows better result in group 2. Difference is not significant, and group statistics of mean for uncorrected intermediate visual acuity at 80 and 60 centimeter for group 1 and group 2 shows better results for group 2. Difference is not significant, and group statistics for mean for uncorrected near visual acuity at 40 centimeter for group 1 and group 2 shows equal result in both the group. Difference is not significant. This is the graphical presentation of it. Regarding the defocus curve, significant difference between the group 1 and group 2 defocus curve were detected for all versions from +2 to -4 diopter, which shows autofocus. Group 1 gives continuous range of vision for near, intermediate, and distant vision. And regarding contrast sensitivity, shows significant difference between better results in group 1 with a p-value of 0.001. Regarding photic phenomena was analyzed on 4-point scale. 1 is for not at all and 4 is for severe. The portion experiencing the glare, mild, moderate, and severe was lower in group 1 versus group 2, and experience of mild halos and hazy vision were more common in group 2 than group 1, whereas the experience of starburst, blur vision, and multiple images were equal in both the groups. This is the graphical presentation of it. Regarding patient satisfaction assessment, the performance of night vision and spectacle freedom is better with group 1 as compared to group 2, whereas surgical results are equal in both the groups. This is the graphical presentation of it. In this study, we have a limitation that are less sample size, non-randomized sample, short follow-up data, absence of certain contrast sensitivity measures, and exclusion of reading speed assessment. To conclude, autofocus pro ringless polyfocal progressive IOL had comparable visual outcome for distance, intermediate, and near vision with high contrast sensitivity. It also allowed spectacle independence, glare, and halo-free vision with good patient satisfaction. Thank you.
Thank you.
This autofocus is from which company?
It is manufactured by Milli Optics. It's launched in January 2020 to 22. 22.
It is totally ringless.
Yeah, it has three zones. Upper zone for distance, one triangular zone. The apex of the triangular zone would be in the center, and the lower zone, that is for intermediate, and the lower zone is a wider zone for a near vision. Basically, it's a segmented lens, and there is no light loss in this lens. Uh, the available right now lenses, they have a surface modification, either in form of a asphericity or creating a diffractive rings. But in this lens, along with that surface modification, there is asphericity in anterior surface, that is 0.1 negative asphericity. But along with that surface modification, they have made a change in the refractive index, that is called a gradient refractive index technology. In that, the superior part, for the distance, they have hydrophilic material and a refractive index of 1.45, and continuously the refractive index that is gradually increasing to the lower part. The lower part is towards the hydrophobicity. So surface modification and change of refractive index, that focuses and drag the rays from distance intermediate to near vision.
Does it take adaptability for the patient in the post?
I can have a video.
No, adaptability.
Adaptability is good. I have a video of 1 minute, if you allow.
Afterwards, we have 2 more presentations, and I think next session we
Just
have
only
to do
1 minute review of the
afterwards.
okay,
Let the presenters present.
Okay, okay,
We'll
okay.
come back to you.
Okay.
Thank you.
Thank you.